Alright, so we are at Ogwa Teachers Cooperative Credit Union here in Cape Coast with Cape Coast Teaching Hospital with nurses and other health professionals doing a health screening program for the people in Cape Coast. What we are doing here is to just create breast cancer awareness and see if there's any problem. We detect it early and then find solutions to them as early as we can. And we are happy that everybody is coming around, and we are hoping that you watching us will also take charge of your health and come around as well. Is it looking good? So here are a few people we spoke with. Spoke with a few people, asking them about what they think, whether they have any form of encouragement to anybody out there who may want to take charge of their breast health. And here's what they had to say. Okay, we are happy saying wait to me about for health screening. We are actually happy that you are taking charge of your life. Breast cancer screening here and then push you for screening.
Okay. Me feel me na when your breast cancer.
Oh, I see.
For 16 years.
16 years.
With chemotherapy.
Oh.
And you when your problems too. And now I am the day. After work, what the abaka now when you to them my Bible says today because I sometimes yesterday because it's a baby them who fear or easy they abuse to me now like many I did them and put them up and maybe should there to be fine and sometimes and I may have men's side but before I may meet pain in the wall me breast now I'm as a margin but in the way it's something to upon a cadet.
That's very good. We are actually happy. Say, wait me okay. So what they are buying now is stroke price. Oh, baby. All right. So we are not must be okay. And then you may say, it's no wait time. No, so what's how what to say screening be because say now our baby. Okay. So that means that what's your grandma in the story? That means only breast cancer baby. What do you know about it? What is breast cancer?
Okay, kakra I mean there. So obi everyday we do obi any breast cancer and the measurement and another example. Because before obi any no me will say moja bida the breast no asia kakra.
Okay.
E wo muso because aberewa we ni there wo say nsuo fi yenufu na anono wo say nsuo fi mu eba nti no o complain sa we no ti edidi mu ana ebo nsa bebi ana aye moja no ase we rashes bi begu e ho no nti e ho no na ye hu say ase ahase kwede nti ye si bibi di anansi nti na ye nti ye anansi so before that na ye ti say ye breast cancer ti kro no na na bi hu say breast cancer wo bibi sa anase anya moja kwa no wo wo no say nsuo bi fi wonu fom oba eno so eya ye bi say wo ye nya sa breast cancer ntina me de da ma de say me hu bibi a
yes very correct nyamana o kan eno no I'm very happy say with him if anything na who say nyamana na wa bantem na emom no ye mpese say nyamana ko besi ansa wa ba hospital no with time no ya na wa so wa examine no breast and as I to say screening be koso a na wa ba ma ya check ya no so unim nurse bi wo area so to me call in chain na wa check ya ma why ya da si na
ye bi ko mo ba 1 year
1 year na wa check why ya da si say wa ba nyami show bye bye patron say person Josephine okay yeah, that's to say, and now I'm now open ceremony and casa. Okay, it's another than my by breast screening.
Nah, you're more. Nah, some baby today, young blinded.
nti obi ka se mombra na mombeye na obae nti no na usuro se obaya beya ana na usuro na unim ade a obeye de unim ni ana omo hwehwe unim ade for unim okay na what be a friend of breast cancer da what da dad Oh, okay. Omo mo aba. E wo nufu. Okay.
No way,
also on your breast cancer. After being no ache. Be 5 years last year. Nti no sa aba no aba enye normal. But eno so enye cancer. Nti no for your nufu no your amba bi wo ho a etimi ba nufu ni mu eno no ensese da ho. Menu so onye cancer. Ebi so ho a cancer. Nti so mu yi a omo de collab no mo ahye say cancer na say enye cancer. Nti say afi na etwe mu no koe no hwe. So bi o ha on hwe. Nti no with time no say wan kasa o ho na say hu bibi sa bi o ma. Me nka say be san ba o ba hu bibi sa. Or say we dey go hospital now wo dey kosh wo mo shema right.
This is Eunice Mary Abua.
And you are the chairperson for this
Obua Teachers Cooperative
Obua. She's here with us to tell us about her experience, what she knows about breast cancer. Okay, so you are welcome.
Thank you.
Alright. So today you are coming to do the breast screening, right? Why did you want to do the breast screening in the first place?
Thank you. I want to do the breast screening because I know as women, as we age, we are supposed to know whatever that is happening to our breast, and as women, breast is very important part of us. So I decided to come and check whether there's anything wrong with me.
That's good. That's good. So are you concerned that we may find something abnormal? Are you worried about it? Is there any worry at all?
Not really, because I've been doing it.
Oh, that's
I do
nice.
it maybe twice a year.
Okay.
Every October I make sure I do it.
Okay.
And then beginning of every year I do it.
Alright. That's a very good thing. What do you know about breast cancer? What are the signs? What do you want to tell people? What should we see to know that these are early signs of breast cancer?
I know you can do it personally. As you lie, you use your left to check whether there's any lump or something. Then from time to time you look at your nipple,
okay.
Whether there is any change or something, you do that. I think if you continue to do that and there's any problem and you go to the hospital, they are able to detect. If you detect early and you are helped, it is better than to wait till it becomes something else. So the moment you see a change in your breast, whether in size, color or anything, is something that you are supposed to be worried about. So that's what I can say. I am telling all women, whether young or old, and men as well, because at a point in time we realize that men also have cancer in the breast. So everybody is at risk, and some of us who have relatives who have had, you need to be cautious of that one. And then I think our lifestyle and all that. So I'm saying that everybody, once in a year, even if you don't do it at all, in October, make sure you give care to your breast. Thank you.
Thank you so much.
I'm from Efua.
Okay, Madam Efua. Nampochone. Oba dentina eba there when you breast screening the mouth.
First, na ya musho.
Okay.
Motion mutin no some TV da. No musho da mokomo motion mo bakade. Would be na men ya but matina wa na musuno. Mamba check na say you be won the bibi wo ma wo mom no we dru ntama almost solve there. Matina wa amazin wa ho. And so nam do mama bed am boshe.
Na breast cancer or abade. Another work there no fumu kukrama or abade.
Ma mu be the but my sister, my cousin. Okay, chairman there. Oh, one the name of Numu. Oh, yeah, na man from catch and I on financer. Under one on finance on fan. But I'm in there, McCann. While fire, you know, when you make a sauce, I want to bet my hostage. I'd need you able to name of the man, and one called the woman in drama. When say mass some other chapel, some wake baby. It's someone that was no more shene. The baby way 2 ways, one open tamamo. And so I'm from a bay. Don't ask there, they were 2 wabam, much maba check there. She you mean for Moshamaka, my uncle Fabian, but check no yard papa.
My name is Christiana Ajeti.
So today you came to do a breast screening, right? Why did you come to do the screening in the first place?
With a recent event of today breast cancer, tomorrow that's and as human as we are just like machines or cars that sometimes need to go to the mechanic. So with this health screening, it's part of it should be part of our normal human life. So once in a while. So once I'm with the credit union and they are doing the health screening, I don't need to go and stress myself, and then I can just do it for free. Why not?
Why not? It's free.
Yes, even if it's not free, something that is about my health, it should be a priority. So it's for my own good. That is why I did it.
That's good. So you've done the screening. Did they find any problem?
From her, no.
So they
Well,
really
from what
find,
she said, no,
so they
she
didn't
didn't
find
say
any
anything.
problem. All right, that's good. So you're happy about your results, right?
Oh, sure.
All right. So you're going to go ahead and keep screening at least every 2 years, right?
Okay. Yeah.
All right. So what do you know about breast cancer generally?
I know that it's a condition, basically though men also get it, but since women are the most we have enough
Big breasts.
So it looks like we say it's a women disease, but I know men also sometimes get it, but the women. So it's a cancer of the breast, and usually there are stages. From what I learned, there are stages. So if you see it early and then you go for treatment, they can treat it. Some they can just do normal, maybe I don't know your medical terms, but whatever they have to do, and then depending on the stage, if it gets to a stage and then going through that treatment will not help, they will have to operate and then remove it. But whatever it is, I believe it is for your own good. So it's
So what features do you know that when somebody sees they should prompt the person to come to the hospital?
I learned usually you should study your breast around the nipple. If it's discharging, maybe you press it and you have some discharge, which is not a normal type. If you are breastfeeding, fine, you have the milk, but let's say it's bloody or some color that is not presentable, it should be a source of concern.
Exactly.
And then also when you do the self-examination and you find a lump or something that is like a lump in it, and you are not certain that is moving, it's better you go for them to say ascertain whatever it is, if that is it. And then I also learned the texture around the breast.
Yes.
It has something like orange something. So when you are seeing those things and you realize that it's not the same with the other breast, then you should also check.
That's
so those are the
good.
few things that I
Yes, we are very proud of you. Do you have any questions for us, please?
Sometimes people talk about early diagnosing and then, but at what point in time should a person, somebody will get to the hospital and they say it is, what happens before that surgery? And I get scared when I hear people talk about their breast being removed. That's the aspect I normally don't know what actually calls for that. And then,
so we have stages of breast cancer, like you said earlier. So if the cancer is small, all right, and only the cancer can be removed, it hasn't spread to other parts of the body, and only the cancer can be removed from the breast without removing the entire breast, and then add medications to it, or we add something we call radiotherapy. But when we realize that it has spread, or it has spread throughout the entire breast, then we have to remove the entire breast to save your life. If we don't remove the entire breast and we remove only the breast, it may continue spreading. You understand? So depending on what the person presents with, everybody's breast cancer is unique. So depending on what the person presents with, then we decide on what to do. So it's not, I can't give you a one answer. Specific. But it is varying, very, very different. For some people, we don't even remove their breast because it is too late. So for those people, yes.
You leave them to die?
No, we don't.
What do you do?
We don't leave them to die. So we give medications to slow the disease down. But you cannot, like, it has advanced so much that you cannot remove them. But even if you remove it, it has already spread to the brain, it has spread to the other parts of the body. So it depends on how far it has spread. They may die within a year, they may die within 2 years. So we don't want that to happen. You understand? So we call it palliative care. Palliative care, where we slow the disease down for them to arrange their affairs. If maybe they want to get married before they die, or maybe they want to build a house before they die, we give them that chance to do all that. They want to travel to France before they die, something like that. But we don't want that to happen. So if you see something early, we even got a 19-year-old today who said she saw a lump in her breast and she went to check it. They removed it for her. When they removed it, they checked and realized it wasn't cancer. It was a benign type of tumor. It was a breast tumor, not cancer. So that's what we want. We want from you people. We want you to come early. And even if it's cancer, if it's small, we are happy. We are not happy that you have cancer, but we are happy that it's small.
You see it early.
Yes. Okay.
But I learned when they cut those that they remove the breast, like it will come again.
Well, if you don't remove all the cancer, the rest that remains will grow. Cancer is like a living thing. It's like a snake. When you cut the snake, the tail, what will happen? It's still there. The snake is not dead. But if you cut the head off, it is dead. You understand? So sometimes some cancers can trick. It can trick you where you didn't see the entire thing and you removed only a part of it. If you remove a part of it and maybe you didn't see the rest, yes, the rest that was remaining can grow back. So yeah.
Thanks so much.
So we are glad you came, and
I'm so glad. Thanks for the education.
See you.
I'm Miss Sandra, working at the Cape Coast Teaching Hospital. I'm part of those doing the breast screening examination. We are trying as much as possible to create awareness in order to reduce breast cancer in women. So we are trying our best to make the awareness go worldwide, locally, internationally, and across the country. We are trying as much as possible to make sure that women who are getting cervical cancer in every year reduce. And I encourage everyone to be part of this exercise. Early detection with early treatment will help us to eliminate it. Thank you very much. The breast cancer is there, it exists. And looking at the analysis, it's one of the dangerous killers in our community, especially in women. So there are certain signs and symptoms that will let you know before it gets worse. That is, sometimes you see some fluid coming from your breast changes, the color, and a whole lot. So the moment that you see those changes, immediately you have to go to the hospital for early detection. Once it is detected early, treatment is possible. And again, you have to be doing self-examination in the house. It's not something difficult. If you can't do it, you can go to a nearby facility, or if you have any nurse closer to you, you can go to the person will assist you. In every year, especially in October, we try as much as possible to create that awareness here in Ghana. So if we hear of any breast cancer awareness or screening going anywhere. Mostly it is free. So you can go there and you'll be screened and it will help you. So once you hear of it, you can call a church member, a friend, a colleague to also go and then examine herself so that it will help reduce breast cancer in women. Thank you.
Mrs. Nurse Kuma, me a senior staff nurse at Milwaukee Post Teaching Hospital, Public Health Department. And in this month here, October, I was soon there. Yes, you were there. Get you for the roof for your baby or fun from a window. I'm coming to on your way. The phone is inside. And I could wash away from your baby and they go home. And they be more. Then you be there, Miss Shaw was there. Musuya, you will or get a day when yes, get to move for more show now. The sand of behind. Only then. So one in Tama, or to do to a room, Yarban, Uncle Zunya, Limbo sets now. Nay, what been the Bibia by a year? The woman, now for the wap on way into Mignon Shea. On into the wire mania some day. In the day of your October month, ya. Yes, where the body roof from your bedroom. Mouth and the mania some. And nursing, me water chunkomi, Minyanko Moy when yasam. And they was sending Poby. And na obi oben wo bia inhu ni not then oye we jesam anado oye yew oye jew ankasa me hu obi we nya biza nyimpoku ni so sun na nyimpoku ne busan ko oben e ho wo ko ni na waye me nya sama me wo
na we
hospital bia oben health center bia oben any hospital bia ya botuma akọ emma wa hwehwem na we hu there and a breast cancer will be and now we need and any be name. You be another doctor why and our dad for me. Bye bye.